The problem of hair loss is very important. Why? Because it is not only a medical problem, it is also an aesthetic problem and, most importantly, a psychological problem. Men and women affected by hair loss, not only they have the aesthetic problem by facing other people, but most importantly, they face their own self in the mirror. So, it is very important, as you understand, to find ways to deal with the hair loss issue. Hair loss is quite common. It is estimated that by the age of 20, more than 20% of men will have some degree of hair loss, and at the age of 50, almost half of the men, 50%, will have some degree of hair loss. At the same time, women are equally affected by hair loss, in the same percentage as men. As you understand, it is a very common problem. By far the main cause of hair loss is the so-called androgenetic alopecia or male pattern baldness. It affects more than 90% of people suffering from any kind of hair loss. It is a cause connected with our own genes, with our DNA. So it affects equally men and women that they have it in themselves, in their DNA, they have the genes of hair loss. Less common and less important causes of hair loss that constitute less than 10% of all the cases are alopecia areata, cicatricial alopecia, and traumatic alopecia. Also, different kinds of medication, hormonal issues, anemia are some other less common causes that may cause hair loss, especially in women. It is believed that many factors may affect hair loss, although in a manner that we don't really understand at the moment. So, many people say that malnutrition, stress, pollution may affect the degree of hair loss and the progress of hair loss in men and women alike. However, we cannot be certain at the moment that there is one factor that may be more important than the others. Okay, this is a matter of ongoing research. Hair loss at the initial stages may be treated by conservative treatment. By this we mean medication, and unfortunately we do not have many weapons in our armory. We can only use actually two substances. One is called minoxidil and is in a form of a lotion, hair lotion. The other is a tablet called finasteride, which is an anti-androgen medication that may stop at the early stages, I repeat, the progress of hair loss. The only problem with conservative treatment is that it can be effective for as long as we use it. Unfortunately, when we stop using conservative treatment, the progress of hair loss still continues. So, the final and definite treatment for hair loss is surgical treatment. And we will elaborate on this further on. Nowadays, worldwide, there are two techniques that are used to deal with hair loss. One, the older technique, is called AVUT, or as it is known commonly, strip technique. And the other, the most modern technique, the most advanced, is called AVUE, by the initials meaning follicular unit extraction, which means that we can isolate and extract single follicular units. And this is the most modern technique available today for final and definite restoration of hair loss.